Hi everybody, welcome to my channel. Thank you so much for joining me today. If we haven't met before, my name is Steffi, and today we're going to talk about how to become a registered nurse in Australia. There are two ways in which you can become a registered nurse in Australia. The first one is to enroll in a university and study nursing. So you would come here as a student in a student visa, study, complete your training, and then go on and register and then become a registered nurse. So the second way, which we will be talking about in depth today, is the outcome-based assessment exam for internationally qualified nurses and midwives. So just to give a bit of a background, prior to March 2020, if an overseas trained nurse wanted to come and practice here in Australia, so all you had to do was enroll yourself in a university which offered the bridging course, which used to be 12 weeks. Come here, complete your bridging course, and then apply for registration, and once you get your registration, then you can work. But since March 2020, the Nurses and Midwifery Board of Australia has transitioned now from the bridging course to what is now called the outcome-based assessment. So the outcome-based assessment is basically made up of two exams. The first one is NCLEX, which is a multiple choice question exams, and the second one is called OSCE. OSCE stands for Objective Structured Clinical Examination, which is like a practical exam. So as an internationally qualified nurse and midwife, if you want to come here and practice in Australia, there are a few steps that you would have to go through. So the first step is the online self-check. The second one is orientation part 1. The third is the portfolio update, and then comes the outcome-based assessment. So these are the steps that you need to fulfill and go through before you could even apply for registration in Australia. So let's talk about the first step, the online self-check. So let's have a look at what the online self-check is all about. So in the online self-check section, what you have to do is go online and enter all the relevant information for your qualification. So once you've entered all the relevant information in the self-check segment, you will be assigned either a Stream A, Stream B, or Stream C. Let me just explain. So Stream A nurses would be nurses who have done their qualification from countries that have similar practices and standards as the Australian healthcare system, regulations and standards. So Stream B is for internationally qualified nurses and midwives who hold a qualification relevant to the profession, which is nursing, but are not considered to be similar or equivalent to the Australian standards. So countries like India. So Stream C is for international nurses and midwives who hold a qualification that is not substantially equivalent or relevant to the Australian standards. So as I mentioned earlier, nurses who have completed or attained their nursing qualification from India are usually classified as a Stream B nurses. Coming back to the online self-check, so once you've entered all the relevant information, you will be categorized into Stream A, Stream B, and Stream C, which if you have attained your qualification from India, you will be classified as a Stream B. As a nurse who is classified as belonging to Stream B, what you will then need to do is complete two exams. One is the NCLEX exam, which is a multiple choice questions, and the second is the Objective Structured Clinical Examination, which is OSCE, which is basically a practical exam. So then once you've completed the self-check, you will be advised to pay a fee of 650 Australian dollars, which is to be paid with credit card. And once you pay that amount, you will get a receipt via your email to say that you've made the payment, and then you can proceed to the next step, which is orientation part 1. So what orientation part 1 is all about is it's basically an online learning course which you can do it from home with your iPad or your tablet in your own personal device, basically at home. So the online learning will introduce you to Australia and the Australian healthcare system. One very, very important thing to note here is once you've completed the self-check and you make the payment, you have 90 days to complete the orientation part 1. So far you've completed your self-check and your orientation part 1, and the next step in this process is portfolio update. So what portfolio update involves is for you to enter or upload all your relevant information regarding your qualification, your registration, and your identification. And these documents have to be attested. Now, I'd just like to mention here that process of having your documents attested in Australia is very, very different from India. Because I remember when I was in India, if I want to get my documents attested, I basically have to go to a government official who is authorized to attest documentations. But here in Australia, what they will accept is that it has to be notarized. So if you go and check the APRA website or the Nurses and Midwifery Board of Australia website, their requirements are listed there as to who can attest your documentation. So when it comes to uploading your documents and getting your documents attested or certified, as we would call it here in Australia, I would like to remind everybody, please, that you have to be very, very thorough and pay attention to details, because I don't want you to make the same mistakes that I did, because the whole process is long enough as it is and draining and stressful. So you don't want to lengthen it or prolong it any further by uploading the wrong documents or uploading a document that is not attested properly. When I was applying to come to Australia, I made those mistakes. So one mistake will cost you time, which is valuable. Make sure you tick every box before you upload it. So, do it right the first time. That's my advice to you. So once you update your portfolio, the submission process is kind of complete. Like what you have to do from your part is now kind of complete, and you will have to wait for a couple of days. Based on all the information that you put in, including your documentation, everything, the NMBA, which is the Nurses and Midwifery Board of Australia, will assess your application and will advise you of the outcome of your application in a couple of days. So if you have satisfied all the requirements of the Nurses and Midwifery Board of Australia, you will then be given permission to sit the NCLEX exam. And once you are authorised to sit the exam, you will be given the ATT, which is Authority to Test. And this email will be from Pearson, which is a third party which NMBA has contracted to conduct the NCLEX exam. So you can give the NCLEX exam in one of Pearson's centres. And the fee for the NCLEX exam is $350. And you clear the NCLEX exam. So the next step after you clear the NCLEX exam is the OSCE, which is the Objective Structured Clinical Examination. And I want to mention here that it is very, very important to have some sort of clinical experience in India prior to coming here, because OSCE is a practical exam. You will be given clinical scenarios where you would be required to use your clinical knowledge and experience and clinical skills to make clinical judgment based on the scenario that you're presented with. And in Australia, OSCE, or the Objective Structured Clinical Examination, is conducted in Adelaide, which is the capital of South Australia. And the cost for OSCE is 4,000 Australian dollars, which is roughly equivalent to about 2 lakh Indian rupees, I'd say, dependent on the exchange rate at the time. So now you've cleared the NCLEX exam, you've cleared the OSCE, it's so exciting. This is the time when then you will apply for your registration so that you can get the license to work and practice in Australia. And once you get your registration, I have to say, as a nurse, your career options are limitless, really. It depends on how hard you want to work, where you want to work. There's so many options to choose from. And from my personal experience, I think it is the best profession to be in, especially in a time like this where people are losing their job, unfortunately, because of COVID, but nurses and healthcare professionals are in such high demand. So in this video, we've covered the entire process from getting Selfcheck to orientation to portfolio update to giving the exam and clearing the exams and getting your registration and working in Australia. Please do share your comments. If you have any questions, just pop it down below and I will endeavor to try my best to answer those questions for you. But thank you so much for joining me today. I really, really appreciate it. I would love to hear some of your experiences. Where are you practicing right now? Are you planning to go overseas? What are your aspirations as a nurse? Yeah, I would love to hear from you guys. Please check out my other videos where I share my experiences. Please don't forget to subscribe. And I look forward to seeing you next time. Thank you so much for joining me. Bye.